If your tongue suddenly feels heavy, if your words come out slurred, even for a second, if you notice a strange color in your mouth when brushing your teeth, don't ignore it. These could be your body's first warning of an incoming stroke. And for men and women over 55, these signs are far more common than you think. Hi, I'm Dr. Luke Smith. With over 30 years in stroke prevention and circulation therapy, I've seen lives change and lives saved by paying attention to the smallest things. Today, I want to talk to you about a body part most people never think of as a danger signal: your tongue. Yes, this small muscle in your mouth can give off subtle clues, from color changes to strange sensations, that may indicate your brain is in trouble. I'll break down the 5 most important tongue-related stroke warnings every senior should know. One of them saved a woman's life last year, and I'll tell you her story in just a moment. But first, if you're over 55 or love someone who is, I want you to do this right now. Hit that like button, click subscribe, and ring the bell, because every week I share science-backed ways to prevent stroke, improve circulation, and protect your brain naturally. Let's begin. Let's begin with warning sign number 1. A pale or purplish tongue. Now, you might be thinking, isn't that just from something I ate? Sometimes, yes. But if your tongue looks washed out or has a persistent bluish-purple tint, especially in the morning, pay attention. This is often a sign of poor circulation. And in older adults, poor circulation can reduce the oxygen supply to the brain, leading to mini strokes, or worse, a major event. Let me tell you about Irene, a 67-year-old woman who came to my clinic feeling foggy in the head. Her blood pressure was slightly elevated, but what really concerned me, her tongue had turned pale lavender, almost gray. She said it had been that way for a week. We did a vascular screen and found early signs of arterial narrowing. We caught it just in time. She was weeks away from a full stroke. Thanks to some changes in her routine, which I'll share with you later, Irene avoided disaster. So here's the rule. If your tongue loses its healthy pink tone, or if it turns purple and stays that way, don't wait. Get your circulation checked immediately. We're just getting started. Next up in part 3, the tongue symptom that mimics numbness in the arm and could be just as dangerous. Make sure you're subscribed, and let's keep going. Let's talk about warning sign number 2, tingling, numb, or even burning sensation in the tongue. Now, this one catches many people off guard. Most folks associate numbness with the arms, face, or legs during a stroke. But your tongue is a muscular organ, loaded with blood vessels and nerves. And when circulation drops or a clot forms, it can be one of the first places to feel the change. I had a patient named Rami, age 70, who came in because he felt like his tongue was falling asleep. He said it started in the morning, just a light tingle, and by the afternoon, it felt like he had dental anesthetic, except he hadn't been to the dentist. We rushed a CT scan, and guess what? He had a mini stroke 24 hours earlier, and his body was warning him about another one brewing. That tingling was not random. It was his body screaming for help. So here's the takeaway. If your tongue feels tingly, numb, or you feel a strange burning sensation that won't go away, it's not something to ignore. It could be your early warning. Coming up in part 4, a surprising color change on the tongue that women over 60 must recognize. Before we move on, if this message is helping you, take a second to like this video, subscribe to the channel, and leave a comment if you've experienced any of these strange symptoms. Comment 1 if you like the video, and 2 if not. It will really help us. It could save a life, maybe even your own. Here's one that most people, and even some doctors, completely overlook: a pale, bluish, or purplish tongue. Now, let me explain what this means. Your tongue is supposed to be a rosy pink color. That pink tone comes from rich blood circulation, your arteries delivering oxygen to the tissue. But when your tongue suddenly turns pale, or worse, starts looking bluish-purple, that is often a sign that blood flow has slowed down, or that oxygen isn't reaching the tissues properly. This is especially serious in people over 60. One of my longtime patients, Margaret, age 66, came in complaining about her tongue looking grayish in the mirror. She thought it was just age. But after a full vascular workup, we discovered she had carotid artery blockage, one of the leading causes of ischemic stroke. She had no facial droop, no arm weakness, no speech problems, just a discolored tongue. But that one symptom helped us intervene before a life-changing stroke could occur. So here's what I want you to do. Every morning when you brush your teeth, take 5 seconds and look at your tongue. If it looks unusually pale, dark purple, or blue, do not ignore it, especially if you feel dizzy, tired, or have trouble concentrating. These are your body's early red flags. And in my experience, people who catch these signs early stay stroke-free longer. Coming up in Part 5, I'll reveal the tongue symptom that almost no one talks about, but I've seen it appear days before a major stroke. Before we get to that, please do me a favor. Like this video, subscribe if you haven't already, and share it with a friend or family member over 60. You might just save their life. There's one more sign I want to talk about. It's something I've seen in stroke survivors, and it often happens before the major symptoms. It's called the tingling tongue. Now, let me be clear. This doesn't mean your tongue is numb from spicy food or a hot drink. I'm talking about a strange pins and needles sensation, or a feeling like your tongue is vibrating or buzzing with no clear reason. It may last only a few minutes or come and go, but in my practice, this has sometimes shown up 24 to 72 hours before a stroke. Let me share the story of a patient named Howard, age 70. He came to me saying, "Doc, this sounds crazy, but I feel like my tongue is tingling, like it's asleep." I ran a vascular scan, and guess what? He had a 90% blockage in the left carotid artery. That's the main blood vessel supplying the brain. We sent him in for immediate treatment. 2 days later, his scan showed signs he was just hours away from a possible TIA, a mini stroke. But we caught it, and all because he noticed something odd, not in his brain, not in his heart, but on his tongue. That's why I'm telling you now. If you ever feel an unexplained tingle, buzz, or burning sensation in your tongue, don't brush it off, especially if it comes with headaches, confusion, or weakness. Now, there's one more step I want you to take. If you've experienced any of these 5 warning signs on your tongue, from strange coating to discoloration to tingling, then I want you to download my stroke-free After 60 grocery list. It's filled with circulation-friendly foods that I recommend to my patients every single week. You can find the link in the description below. And don't forget to like this video, subscribe, and leave me a comment. Let me know. Have you ever noticed a strange change in your tongue? Your story might help someone else recognize the signs and take action. This is Dr. Luke Smith, reminding you, your body whispers before it screams. Learn to listen and stay stronger after 50.